how do you make it affordable, but as well as keep the quality? Because I feel like, is that the issue here? Like, is that one thing about Dubai? Is that a factor here, making it affordable as well as keeping the quality?
This is a very important subject because it is number game. Healthcare is also economy of scale. Like, for example, if I am doing a cardiac surgery program in my hospital and I am able to do only 4 surgeries in a month, the cost of the doctor, a quality doctor, like a doctor whom I am paying 100,000 a month, gets loaded to 4 surgeries. So it is economy of scale. So that's why our prices may be higher. Now we have to see international benchmarks. If you talk about cardiac surgery in US, it costs something between $80,000 to $120,000. If we do it here, we are not doing for less than $25,000 to $30,000. If we go to Thailand, they are doing it for $12,000. If we go to India, we are doing it for $8,000. Now, in terms of quality, we have comparable infrastructure, technology, and skill set of doctors. In terms of infection-free environment, I think we are one of the best. What we don't have is numbers. And if we don't have numbers, then we will not be competitive. Now, as Dr. Ala said, that we are a young country and we are only there for last 5-6 years in this business. Now, there is lot of positivity coming into this. What is happening is insurance is getting privatized. So what is happening that people who are traveling overseas are thinking twice, because people who have been living here, they have families here. If somebody has to go for a cardiac surgery to India or Thailand, the entire family gets inconvenienced. So they will look for a local place here. So what is happening is that numbers from the local market are improving. So if I am able to get some decent numbers, now again, as he was saying, I fully agree with him, because we don't have to reinvent everything. We have to see internationally how people have done. So all the key opinion makers have to come together. Like, for example, in healthcare, what has happened is, because of business opportunity, everybody has come up, sorry, forgive me for this, with Me Too kind of hospitals. Everybody has opened similar kind of hospitals. Very few people have identified a niche for themselves. Like, for example, we are talking about one example of cardiac surgery. If 4 people are only allowed to do cardiac surgery, everybody will have decent numbers. So what will happen is, I am able to offer at a lower price. So if I am offering at a lower price, I am also becoming attractive for international patient. Price is very important, and price again is very subjective, because quality and price. India quality is very good. Thailand quality is good. So if somebody is offering at $10,000 here and I am offering at $25,000 here, yes, there is a situation. But at the same time, together as a country, we have to address this. Because what will happen, and you know, and we have talked about it, that if we do not project ourselves as advanced tertiary care destination, people may hesitate to come to us. What happens, even for cosmetic surgery, lot of complications all over the world are known to happen. So a person, before choosing a destination, does lot of research that in case, God forbid, some complication happens, is this country well equipped to handle the situation? So one thing is that all the key opinion makers have to sit down together and decide that He as Emirates Hospital will do cosmetic, me as RAC Hospital will do cardiac surgery. And I think differently. For me, the word competition does not exist. We have to find ways to cooperate, collaborate, and work together. Then it is win-win for all of us, for the industry and for the country. So if all of us, the key opinion makers, could sit down together and work for a common cause, that is promoting UAE, Dubai or Ras Al Khaimah as medical tourism destination, it will be win-win for everybody. So price, coming back to your question, sorry I take a long time, but I have to give you the background of calculation of price. Because people say UAE is most expensive, but there is a reason. But I will tell you again something else. People should not in isolation look at price. What happens is, you choose a destination which is offering a cardiac surgery for $10,000. You will jump at it. But you have to see the outcomes. Because God forbid if you get infection from a hospital, some complication happens, you end up spending triple the amount. So that has to be seen. That way we are in a fortunate situation here. I'll give you example. In RAC Hospital, we talk about 0% hospital acquired infection. You tell me how many people in the world can even think of that. We have patients, we have a guy who is in a comatose situation, unfortunately for the last 9 years, and he does not have a single bed sore on his body. His body is like a baby because the way we look after the patient. This is the niche. This is the brand differentiation of this country. We are able to offer infection-free environment. Thereby the complications, inconvenience is minimized here. So we should not look at cost in isolation. Yes, it is a very important subject on which all of us key opinion makers should work together, which I am sure over a period of time, because we are still young, I'm sure within a period of 2-3 years, we will be able to overcome this and will be able to offer at the same competitive price, but with a niche, with top of the line hospitality, infection free and very less complications.
That's brilliant. That is fantastic.
I agree with Dr. Raza that price is not a driving factor, and we will never ever as organizations in the UAE will compete with anywhere in the world with the price. It's not our intention to lower our price to attract. This is not. It is the quality, as Dr. Raza. There is in Turkey, for example. I remember 3, 4, 5 years ago they started the health tourism for hair transplant. They became one of the leading, and I think at that time they started with $5,000, which was cheaper than the normal in the market. Now it reached $1,000, $1,250 including hotel. But the result is really bad. I mean, they still have the best doctors in some clinics. So right now what's happening, it's you say Thailand is good, but really it's not Thailand. It's 1, 2, 3 facility in Thailand. South Korea, there's a street, you go there, I think there is more than 500 clinics for cosmetic surgery. And they are well known for cosmetic surgery, but out of the 500, even the government will support 1, 2, 3, 4. They say this is what represents South Korea. It's not the others, because the others are not to the standard. But in the UAE, it's different. I can safely say you can go to any hospital, because all monitors, all has at least the minimum standard, which is the accreditation. So I think as a whole, in the future, we will do better. Over there are names, 1, 2, 3 hospitals or clinics that are famous, but people generally say Dubai, they say India, or they say Thailand. Now, I went to India as well, or some hospital I will not go to. So you cannot say India is the #1 in health tourism because all the hospitals are aligned. Because there is 1, 2, 3, 4, 5 hospitals who's probably attracting more than 80% of the health tourism. So I think we have advantage, but again, the price is not our component. We need quality, and we need to show results, and then that will happen. Again, a very valid point. The whole world now are insured. I mean, most of the countries are fully insured, and most of insurances from Europe and US and that covered in the UAE. UAE can accept a lot of insurance. So that burden of money also is getting less and less, unless it's a cosmetic where the insurance will not cover it. So we have a lot of factors going our way.
Thank you. Thank you so much for that. All right, for the next question, Mr. Atari, what should be an ideal response of an organization in any case of complications and in any scenario to ensure that the psyche of the patients isn't affected?
Sure. This is a very hot topic right now, and really it has to be clarified. What is complication? In anywhere, it's classified. There you have malpractice, you have medical complication, and you have negligence. Medical complication is acceptable. In every organization in the world, medical complication will happen. In every procedure, they will tell you 1 out of 1,000, 1 out of 1,000,000, 1 out of whatever number. It is written and documented in the books that this procedure or this surgery will have complication, medical complication. Something goes wrong, not because the doctor or the facility did something wrong. It happens naturally, which is acceptable. There is no, how would I say it, unless the only way to avoid complication is not doing surgeries. Simple. If you don't do surgery, you never have any complications. So medical complications is very acceptable worldwide. There's a percentage, should not be above the percentage, you know. It should be less than the agreed percentage, but not much more than that, because then there is a problem. Now the other two, the malpractice and negligence, these are the avoidable ones. These ones where we look at, and this is the one we really should avoid, and it's not acceptable by any standard. Negligence means that you've done something grossly wrong, and which not fair to the patient or that. This is where hospitals really get affected when the investigation comes that there is negligence, because that means you are not doing your job, from administration all the way to the doctors and everybody else. So this is where we are trying to explain to the public. See, the problem is, sorry to say, media is taking this to a different level, where they also do not wait till the investigation happen and to show what is the reason for the death or whatever happened. They jump on it. Death, we are in hospital. Death is going to happen in hospital mostly. So just because death happened, or whatever the reason is, give it time. Give it time to for investigation, because if you come out and you say, wow, this is the doctors killed the patient, or doctors did something, or the organization did something bad, everybody will remember that. But if it's 3, 4, 5 months after the investigation is over, and the investigation found out that the doctor wasn't guilty, or the hospital wasn't guilty, or nothing went wrong, no one will remember, because it will not make news. The news is somebody died, but the news is not this person is not guilty. So what we're saying, the media should be a little bit sensitive, especially for us. Let's be selfish. We are in the UAE. We are promoting ourselves as we want to be the #1 health tourism, but we are shooting ourselves in the foot. When all the news came out recently and talk about cases immediately, just when it happened, now you are scanning the health tourists, and also the people here are start somehow losing trust in our system, which is not fair. It's not fair. Whatever we are trying to build, including the government, trying to make the image of the organization, the whole healthcare system in the UAE #1, the media comes and try to shoot it down. Again, if there's something wrong, people has to pay for it. The organization has to be responsible, but take your time. Find the reason why this has happened, who is right and who is wrong, and then, the standard is there. The Dubai Health Authority and the government and everybody will take the proper steps. But when the media comes in, it doesn't really serve our topic, which is health tourism. So we really need to see how we all working for the same cause to be the UAE number one. So we have to be careful, again, without losing the rights of the patients, because the patient, we all working for the patient. So their rights is protected and we need to take care of it and to see who's right and who's wrong. But we have to, but the media should differentiate between malpractice, negligence, medical complication, what happened. And this is not the media's responsibility. This is the authority's responsibility. After they come with the reports, do whatever you want. But wait till people hear the second side, because none of us as administrators will go into the debate with the media. So the media will say whatever they want. But if you see in any case, no administration will come out and start defending. We'll say, yes, we are all following the best standards and we are governed by this. But we're not going to say, no, this is not right. This is, yes, we did this. It doesn't open the subject. So there is usually no self-defense. We only listen to it, and when we do respond to it, that doesn't mean it's right. It's just we have to wait for the proper investigation. And this is I wanted to clarify, because really it is, it's not helping our cause. But again, in no way we accept negligence and malpractice. We don't accept it.
Got it.
Can I add a point here?
Absolutely.
It is very important, and it is related to your first question, the accreditations.
Yeah.
So what is accreditation? And that is directly related to your question. Now, if I have an institution which is accredited, which government has taken care, because they encourage people to go for accreditation. So if I have accreditation, what does it mean? And how does it support in what he is saying now? If I have Joint Commission accreditation, I have to follow essentially evidence-based medicine. So evidence-based medicine is very clear. It is, you have outcomes comparable to international. Like for example, if I am following evidence-based medicine and I am following the medical pathways which are clearly structured, as per that, the best hospitals in the world, I will again come back to cardiac surgery about which we are talking, the best outcomes are not more than 98.7 or 98.2. So coming back to what he said, that it is known that complication will happen. But how do I compare with international outcomes? Does it mean that for fear of losing 1.5 patients out of 100, I let 100 patients die? So that's a conscious decision. We are going to benefit 98.5% patients. Unfortunately, 1 or 1.5 or 2 out of 100, we will lose such patients, and this is known to happen internationally in the best possible institutions. Now, this is the art of communication. In healthcare, what we say is, say what you do what you say. If a patient is coming to me, it is my responsibility to take him through the entire journey, the patient and the family, and explain them that 98.7 is the result and my outcomes of this hospital are the same. But 1% cases, chances are it might happen. Life and death is in the hand of God, but again we practice evidence-based medicine. We have defined international medical pathways, and I am audited every 3 years for this by Joint Commission. If I have not followed this pathway, my accreditation will be taken away. Like, I am into this business for 11 years in Ras Al Khaimah, and Alhamdulillah, we have successfully gone through 4 accreditation inspections, and we have passed with flying colors because we have followed the protocols. This is very, very important, because to make a passing comment like this may not be reasonable for an institution which is practicing evidence-based international quality healthcare. So complications have to be seen in view of that. Yes, if a doctor has not followed a protocol, yes, he has to be answerable. But I think in this country, people are quite conscious, and the law is really tough because country is committed to quality and patient safety. So are all of us as responsible healthcare providers. That's why you will see minimum complications in this part of the world, but it is essential part of this business. But unfortunately, which is true for all of us, nobody wants to see complication and death, and all of us react in our own ways. So this is natural. I mean, if somebody loses a family member, it is a sad situation for everybody. But unnecessarily, without proper investigation, blaming a doctor, blaming an institution, or blaming anybody may not be right. Because we are in a country, fortunately, which has one of the best governance practice here. So the Ministry of Health, the Department of Health, and all the bodies here, they are very serious about what they are doing. So I think that is what Dr. Ala is also saying. So we are in a country which has a very strong governance.
And I imagine it doesn't help if the media fuels fire.
And actually, if you look at it, as I said, we have the minimum. I mean, really minimum. We've been here in the market, but the few cases make so much noise. It makes it like it's a daily routine thing, and this is the problem. We are in a community, small community, and with the social media, things are multiplied by magnitude, even though it's a one case, but everybody's talking and so many different stories in the same topic. So it seems that it's huge, but in reality, every hospital in the UAE, I think they're doing excellent in maintaining a very good record, a very good safety record. This is what is the most important. And now there are more initiatives that is not available everywhere that they are collecting data right now. Like for example, I talked to DHA because I work mainly in Dubai. They're collecting data. So soon you can go and see, you check the doctor, you check the facility, you check everything online before you make the decision you want to go to Dubai or Abu Dhabi or Raza. Yeah, so depends or these numbers now will be available for the public. And this is, this is really, we have to appreciate, because which countries have all this public record to can check every doctor, what is their complication rate or whatever. So we are really moving ahead of everybody in a very, very short time. We're taking huge leapfrogs, in this business. So we have to be patient. Things will happen. There is no way in a hospital there will not complication. And but we have to keep it to the standards, as Dr. Raza said.
Thank you for that. So, Mr. Alta, how fast is technology evolving to bridge the gap of traveling to another place for healthcare needs? We do have remote assistance for patients available in some countries as we speak. Will technology kill off medical tourism entirely in the far future?
Very good question, and I like technology. I'm one of supporter of technology, but to a limit. I always say there is technology that is helpful for the organization, the doctors, the nurses, and the patient. And there's technology is a gadget. What fills up the market is gadgets more than the technology. This is my opinion. Okay, technology, there's two technologies. One is the equipments and whatever you use in a hospital, from the radiology department, which is my favorite, to the robotic surgery. This is in the UAE, we probably are in the top right now, because there is a huge competition of buying best of the best in the organization. Everybody, organization in the UAE, they have the capacity to buy. I'll buy today a 3 Tesla MRI. The next hospital wants to buy 3 Tesla MRI with more and better. So we always going above and beyond. So with technology, in terms of equipment, I don't think in one area we have that many excellent equipment. It's very important. So we have the tools. Now, when you talk about the telemedicine or remote, Actually, we just in Arab Health in January, in association with Dubai Healthcare City, we initiated the first, telemedicine. It's not the first, but a new way of getting a consultation, remote consultation. This is an old subject, but to get in right now. In the UAE, we do not need, honestly speaking, because we do not have remote areas. Maybe in some little bit area, but in Dubai, in Ras Al Khaimah, Abu Dhabi, it is accessible. Now the next step is to get a consultation from abroad. This can happen, but in a very minimal, but not for patients. Right now what we're doing second opinion. Some hospitals doing second opinion, like with a very complicated case, they have some tie-ups with Mayo Clinics or Cleveland Clinics to get a second opinion. Is it going to replace anything? No. Because I just told you a story last week. I think last week there was a nursing week, worldwide international nursing week, where we celebrate our nurses. I was looking to see what to say for them to thank them. Technology has replaced a lot of components. They have replaced now surgery. You can do it robotics. The doctor sitting outside and they do it from remotely. There's so many things we've done, but nurses you never can replace, because at the end of the day, the first step of healing is a touch. If you do not have the touch, you will never succeed to heal. So you cannot just sit somebody in a somewhere else, unless necessity and there is a huge issues of traveling. That's a different story. But the patient till today, they need the touch of the nurse, especially the nurse, because they are the one who's making the difference at this stage. So no matter what we do, technology will not replace the human touch. We might do so much, but at the end of the day, if you call a hospital right now and they have the best mobile application and the best advanced call system, do you want to talk to them and do it your own, or you want to see someone who will greet you and be helpful to you? A voice, a human. We are still, maybe the new generation is different, but up to us right now, we still like to see a person, to hear a person, a real person. The human touch, especially in healthcare, is very, very important. Yes, technology is very helpful in a lot of situations and to make things more precise and more accurate and helpful, but it will never replace the human touch. So we need it, but we have to be very smart in using it. We cannot depend on it 100%, because then people will get sick of it. The people, at the end of the day, they want someone to speak to or to talk to.
Absolutely. What about you, Dr.
I think there are more than one answer to the question you have asked. Technology is very important, but the right use of technology is important. Technology we use for a couple of things. One is better outcomes, which is very important. And second thing is to improve efficiencies. Because in times to come, as we have discussed, the price is going to be very important. And as more and more insurance is coming, insurance is going to govern the price. So we have to find a best use of technology. I'll give you an example which he talked about. We are talking about robotics. So robotic surgery, right use of robotic surgery is very important. Like, for example, a prostate surgery, which may not be possible with the outcomes we want with laparoscope. But if I use robotics in prostate surgery, I can have 100% outcomes. So with technology, I am improving my outcomes, which are ultimate. Now, in terms of keeping my price under control, I have to use lot of artificial intelligence to reduce my wastage and bring more efficiencies. You talked about medical tourism getting affected, but I will say it will be positively affected. because technology will help me in giving better outcomes. At the same time, reducing cost. So on one hand, I am using robotics or high-end technology for better outcomes. At the same time, I am using telemedicine to keep him connected. He does not have to come all the way here for second opinion or for a revisit to the doctor. I can keep him connected with telemedicine technology in his place of stay. So the entire expense, which is a waste, can be avoided. So locally, as he said, in this country we are very well connected. But in terms of medical tourism, telemedicine will add lot of value. So this is the efficient use of the technology in improving outcomes and bringing efficiencies.
That's brilliant. That's a very straightforward answer. Like it makes sense. But another question that's been boiling my head. Okay, let's say as technology is developing, it will surely get to a point where if there's any complication, who exactly would be responsible? So if a doctor is using a technology and if something happens, do you blame the doctor or the technology?
You are very smart. You said that you are new in this. This is the most important question, because in terms of governance, like regulatory environment, will you blame the robot?
Exactly.
Will you take the robot to a jail for killing a patient?
Exactly.
So I think we are early in that discussion, but in times to come this is going to be the main issue, because as he said, technology in isolation doesn't work. The human factor is required. So the man behind the machine is also going to be important. But I am impressed. This is the best question of the day. So we are all looking at it, and hopefully we'll come with an answer.
But the answer for today, it's the operator.
Man behind the machine.
Because there are a lot of procedures can be done in the conventional way right now. But again, it's an excellent question. It can be done conventional way where it could be maybe safer. But you as an operator or an organization decided to buy this equipment. So it is your decision to buy which equipment you want. Then your decision is to do the surgery with this robotic versus the conventional way. So ultimately, at this stage, you are responsible. But technology will fail sometime. And that even if you do whatever, technology will fail. And now this is an ethical issue, that medical ethical issue. So we really need to look into it in the future when robotic surgery become more and more. And then who's really responsible? Is it the factory? I mean, ultimately, if you are in the US and you've done everything correct and the machine failed during an operation, you can sue the company itself. We are not reached to this point. So in other countries, they have these issues and they came to know that, okay, 100% everything done by the textbook, but the technology failed, the machine failed. Then the responsibility goes to, if it's proven, it goes to the factory or the agency who sold you this, and then they can be sued. Here we are way far to reach to this where we can investigate technology versus a human. So definitely an excellent question.
Well, I think from what I've heard today, I can tell that Dubai has a long way to go. But it is a possibility. There are loads of opportunities. And
a long way in a short period.
Exactly.
I will rephrase it. I will say we have arrived.
Wow.
We are there.
Wow.
We are a better solution to many countries.
That's great.
And people from the region, from Middle East and from Africa, need not go anywhere. We are right here to take care of them.
Sure.
And I'm sure the viewers would agree with me, but this session was so enlightening. I learned so much for myself, and thank you both of you for taking time off your day and spending it with us. And I hope you guys had a lovely time as well, as much as I did. So with this time, it's time to wind up the show. And thank you so much again for your valuable time. And it's a pleasure to have you both with us. And hopefully we will see each other soon. And we will love to have you both back again. Thank you so much.
Thank you so much for having us. Thank you.